Good afternoon, everyone. Please just give us a few moments here while we wait for our remaining participants, and we'll get started.
Good afternoon, everyone. This is Deputy Secretary Smith. I'm just giving things one more minute because I see the participant number keeps climbing here, and we're only 3 minutes after. So I'm just giving everyone an opportunity to finish joining here. All right. As folks are joining again, good afternoon, everyone. This is Deputy Secretary Jen Smith from the Office of Mental Health and Substance Abuse Services. I want to welcome you to our April stakeholder webinar. Very quickly, before we get started, just a few housekeeping related items first, and what you should see on your screen is a reminder that for Commonwealth hosted meetings, we do not permit the use of AI bots. So if you typically use that technology to be able to take notes or to record things, you'll need to hang up from this meeting. And a reminder that this meeting in particular is going to be recorded. So if you do not consent to participating in a meeting that is being recorded, this would be your opportunity to disengage from the phone call. We will be recording this session. Therefore, folks who typically use AI bots for transcription purposes, you should not need to do that, since this meeting is in fact being recorded and you will have access to it after the fact to go back and listen if that's what you need to do. So Josh, if you wouldn't mind flipping back to our agenda. We've got a number of things to cover today. Thank you so much. For those of you that are not part of OMHSAS, you are joining this meeting in listen-only mode. That means you will not have the opportunity to sort of raise your hand and unmute yourself. So if you have questions during the course of our presentations, you need to use the little question box. And if you look at the slide right now, we've got a big red arrow pointing to the icon that you would click on to bring up the question feature. So it looks like a little chat box and it has a question mark right in the middle of it. Thank you, Josh, for highlighting that. That's where you're going to need to type in your question, and we will monitor that throughout the presentation today. So don't use the chat feature, use that question mark where it says questions. If you have suggestions for future agenda topics for these stakeholder webinars. We've put the email account, the resource account there on the screen for you to use, ra-omsascorrespond@pa.gov. We welcome any feedback you have in terms of topics for future meetings. And I'll remind us again at the end of the meeting, but our next stakeholder webinar is scheduled for July 17th at 3 p.m. So again, thank you for joining us this afternoon. We've got some important updates to share with you about some regulations that we've got in the works, some federal rules and some exceptions to those that we've requested, and a few additional items. So we're going to go ahead and get started. The first item on our agenda this afternoon is I wanted to take a few moments to just address what's been happening within the federal administration and some decisions that have come down and how that impacts behavioral health. So it was a few weeks ago, probably almost a month ago at this point, when we were notified by the federal government that certain funding stream, which was a COVID-related funding stream that came through our block grant, was being terminated. And in Pennsylvania, that would have impacted about $5 million worth of funding that would have been pulled back from a variety of different organizations as well as from our counties. And so OMHSAS's perspective was that we needed to take a few minutes to analyze what that would mean. We were taking a look at our funding streams to figure out if there was a way that we could plug the hole, so to speak, and use some other funding sources to ensure that the folks who were depending on that $5 million were still able to receive it. And so we were sort of in the middle of that planning and those discussions when Governor Shapiro opted to join a multi-state lawsuit, indicating that the federal government did not have the authority to terminate those grants and to pull money back. So a judge issued a stay on that, meaning that the federal government could not take action to pull or to stop releasing those funds to states. So fortunately for us, the money continued to flow and to be available for our counties and for our community partners and partners in higher education that were using those dollars. At this point, that has been the only potentially impacted funding stream that comes to OMHSAS. And I know that there are a lot of questions about whether we believe there could be additional funding streams that are impacted. And the answer truly is we don't know. We are hopeful that's not the case. We've seen some of the proposed budgets at the federal level that appear to level fund the Community Mental Health Services block grant, which is good news. It doesn't appear that there are intended cuts to that line of funding, but we're taking it one day at a time, just as you all are. So I can assure you there is a commitment from us if we learn about any changes to funding or changes to policies, we will absolutely let our stakeholders know as soon as we have enough information to share. I think one of the challenges for us is that, we're typically learning it at the same time the general public is learning about it. And it takes us a little bit of time to really analyze the communication that's being put out and to make a determination as to who it impacts, how far reaching the impact is, and whether or not we truly have to comply with the direction that's being given. So sometimes that means a little bit of delay on the part of state government just for us to really make sure that what we communicate out to all of you is the reality. And so if you hear things, if you're hearing word that there are changes coming, don't hesitate to reach out to us and just make sure that we've heard the same thing or, ask questions of us, but please do be patient with us if we have to take a few days to get back to you to get an answer. So during this time, it is crucial that we keep the lines of communication open within the behavioral health field, that we're all talking with each other and working with each other and collaborating together so that as these changes, if there are more changes to come, are announced, we have the ability of keeping each other up to date and doing our best to work together to be solution oriented. So at this point, I'm not aware of any new changes. I think probably the biggest looming potential change is related to, oh, and Diane Conway is reading my mind. Um, she's asking about the $880 billion cut at the federal level. So this is one of those cases where we don't know any more or different information from what's been released publicly through the media. So, anything aside from that is speculation on our part. I think certainly, as our secretary had indicated in her appropriations hearings toward the beginning of March, if those cuts would be made to the Medicaid program, it would be devastating, truly, truly devastating. There seems to be still some indication from members of the General Assembly that they do not intend to cut the Medicaid program. It's a little bit unclear how they would achieve that level of reduction without touching the Medicaid program, or by simply looking at fraud, waste, and abuse. I can tell you that at least here in Pennsylvania, we already do a tremendous amount of work around detecting and preventing fraud, waste, and abuse. So while there may be an opportunity to do a little bit more, it's certainly not $880 billion more. So I think we are as apprehensive as many of you are about what those potential changes might look like, where they would come from, how quickly they would come. But again, we don't have any definitive information. So at this point, it's very difficult to try to make plans about how we would address that. I know that counties are very aware of these potential cuts. Counties will be one of the groups that will struggle mightily to try to fill those gaps. So if we lose Medicaid funding, that will likely mean a new population of people that will be what we call uninsured. And that's the population of people that our counties typically cover healthcare costs in the behavioral health system for. And that's both in the mental health system as well as the substance use disorder system. So definitely we are all concerned. We are all watching and listening carefully, and we'll communicate anything definitive as soon as we have it. But at this point, we don't have anything definitive. The last thing I'll say about that is members of Congress really need to hear from their constituents on this issue. So if you are well educated about the Medicaid program, if you know how many people are being served and how impactful that program is, now is a really good time to use that information and to educate others, whether that's at the local level, state level, or federal level, who have decision-making authority. So I certainly can't advise you to advocate, but I'll say that you have a tremendous opportunity to use the knowledge you have to educate others who are in a position of decision making. So I don't see any new questions popping in the chat. So I think we'll keep on moving and I will keep monitoring that chat. Next on the agenda, we have Scott Talley, who's going to give an update on our psychiatric residential treatment facility regulations, or PRTF.
Excuse me. Good afternoon, everybody. I'm Scott Talley. I'm the director of the Children's Bureau at OMHSAS. I wanted to give an update on where we are with the regs. And so the next big thing that we're going to be doing is we're going to be having a psychiatric residential treatment facility stakeholder meetings. And it's over the proposed chapters 1330, which is the payment regs, and 5330, which is the licensing regs. The meeting is going to be held on May 21st, 2025 from 10 to 1. It's going to be a hybrid event. So we're going to have about 50 to 60 spots in person, and then we'll also have virtual. The virtual people will be very similar to this meeting, where people in virtual can ask questions via the chat or the question section. And people will allow time for people that are in the building or in the room to be able to ask questions in person. That being said, we're also going to have Jim Sharp from RCPA and Jackie Kreshock from PCCYFS, along with Emma Sharp. I want to thank for helping us put this together. They're going to be monitoring questions along with us. So we're not going to necessarily not verbally answer questions that come across in the chat, but we'll be looking at them as a group and deciding which ones to bring up. The address for RCPA is on the slide there. The registration information will be shared via OMHSAS listserv, and I'm positive that RCPA will be sending it out, as will PCCYFS, as will we will get it to some of our youth organizations and family organizations to be able to get that out. You can go to the next slide. So what we're going to be talking about as part of this, this is the comment period's over. Where we're going is we're going to be looking where we have the highest amount of comments or multiple comments, and address those areas. We're going to be looking at non-allowable costs, reportable incidents, visitation and rights, staffing, training, medical assessment, treatment services, transportation, and manual restraints. And we're going to format it so we are going to share the changes that we have made. We got a lot of great comments, and I appreciate everybody that commented. And some of those comments were very solution-based, and we were able to take a look at them, and some of them made great sense. And sometimes the providers know better than we do, or other stakeholders know better than we do. So we made several changes, which we will share, and we're hopeful to share it before, so you don't have to commit to that. We may have answered a question before you ever come to the webinar. And so our hope is that during the webinar, we're looking for people to be solution-based or be able to provide some alternatives that we can look at to be able to make decisions of whether we want to make future changes. This will be the last chance for people for us to have a discussion with stakeholders until we get to the IRC meeting, and I'll talk about that in a minute. And so we're looking forward to it. If anybody has any questions, you can, I don't know if Don or Crystal are on. If not, we'll send it out. You can ask questions through our RA account, our PRTF RA account, and we'll answer them through there. Josh, you can go to the next slide. Thanks. So here's where we are in the process. We completed our public review, and that the public comment review. IRC has reviewed them, and we've had conversations with IRC, and it's gone to the Legislative Standing Committee per our process. And so we've gotten feedback from all. That's part of the reason why we wanted to do a webinar, because we thought it would be good, based on the comments, to do some follow-up and have some discussion with stakeholders. As I said before, the stakeholder meeting will be on 5/21. Suggested changes may be considered for the proposed regulations, as long as the changes do not expand the regulations coverage to a new subject matter, and it's not in conflict with a federal regulation. We're not allowed to, we have to follow all federal regulations, and we're not allowed to waive them. Then after that is done, we'll update the regulation package for final internal review within DHS and the governor's office for approval. And once we get through all the internal, then we will work with IRC to set up a meeting which is open to the public, and that's where we will look to gain approval. So that's my update, and we will getting the registration stuff out really soon. And Jill, I don't see any questions, so I'm going to pass it to you.
Thank you, Scott. If we can go to the next slide, Josh. All right, for folks who don't know, my name is Jill Stemple. I'm the Director of Policy Planning and Program Development here at OMHSAS. I'm going to give you a couple of updates from our policy world. Big one, the four walls. For folks who are not familiar with this conversation, although I think probably most on the call are, this is a longstanding federal rule that requires either the provider or the individual receiving services to be within the four walls of the physical clinic for that service to be Medicaid billable. As many of you probably know, the feds have put out an exception that states can request in the fall that went into effect on 1/1/25. In order for states to get that exception, we needed to submit a state plan amendment to CMS, letting you all know that OMHSAS and OMAP have jointly submitted that SPA on 3/31 for it to be retroactive to 1/1/25. That exception request will apply to all behavioral health clinics, both outpatient psych as well as our DNA clinics paid through the Medicaid program, as well as a set of physical health clinics that are located in rural communities. So we are optimistic we'll get that exception approved through CMS, and that will be one big piece of the puzzle. The second piece of the puzzle that we need to solve in order to allow services outside the four walls of our clinic is abrogating some of our state level regulation language in Title 55, 1223, which is the DNA payment regs, and 1153, the outpatient psych payment regs. We are actively working with the General Assembly in order to hopefully get those abrogated so that those barriers don't exist at the state level. And then our last step in this process will be to issue a bulletin that will let all of our stakeholders know when both of these things have been accomplished and the four walls rule is no longer in effect for behavioral health clinics here in Pennsylvania. We already have that language drafted, ready to go, so that more or less as soon as we have steps 1 and 2 done, we can put that out to the field and get this issue resolved that I know has been a hot topic since the end of the COVID-19 pandemic. All right. We can go to the next slide, Josh. 2 updates around frequently asked question documents that we have recently issued. We want to make sure folks are aware of. We issued a new peer support services handbook and bulletin in December of 2024. And we have been working over the last couple of months to update our FAQ document for peer support services to align with those changes. That new updated FAQ document is out and available to the public now. So I want to make sure you know that so you can reference it. I'm not sure, Josh, if you can mute someone. I think we're getting background on the call. Thank you. The other FAQ document that we recently released is related to our psychiatric rehabilitation services. That addresses the changes that were made through promulgation earlier in 2025. We have been collecting comments and questions since that regulation was approved by IRC, and that FAQ document addresses those frequently asked comments, questions, concerns. The other update on psych rehab services is that the language that was promulgated is now available on the Title 55 website. We had a short period there where you had to see the new language on the IRC comments, IRC documents, and the old language in Title 55 itself. Title 55 is updated quarterly. That update has now happened, so you can see all of the regulation in its current effective form on the Title 55 webpage now. We hope that is much easier for folks to read, and you can go there and look. If you're looking for our reg information, you no longer have to go to the IRC page. We can go to the next slide then. So other regulatory updates, as you all know, our top priority in the regulation space for policy is our crisis regulations. The licensing regulations are in their very last days of executive review here in the executive branch. They are with the governor's office, and we do expect them to move to the Office of Attorney General over the next couple of weeks. OAG is the last stop in the process before they will go out for public comment. The Office of Attorney General by statute has 30 days to review the regulations. However, I say that with an asterisk because they also have authority in the statute to quote unquote toll the regulation, which means they can pause it if they have questions that they'd like to ask the department and seek clarification on. So typically OAG does toll our packages, and the time frame is usually closer to around 60 days in OAG, but we are optimistic that we will be able to put that regulation out for public comment in summer of 2025 once we get it through the OAG. The payment regulations for crisis are going to be entering DHS executive review in the next month here. Our goal is really to keep those close behind the licensing regs. We don't want them to get too far separated so that on final form, those can go pretty close together. The other reg package that we're actively working on is the 5100 regulations, updating confidentiality requirements. This will mainly be a language cleanup that is already in effect under either HIPAA and or under state statute. So the main benefit of this package will be that our Title 5100 regulations are a little bit easier to read and you don't have to crosswalk as much with other statute. But that is currently with the governor's office, and we are optimistic we can have that out for public comment early fall 2025. My team is also starting to work on some additional regulation packages. The first one is 1223, our DNA clinic payment regulations. That's going to be a very narrow chapter. We're not looking to make huge changes. The most substantive change we are looking to make is increasing the group size allowed from currently the requirement is 10. We will be looking to increase that up to 12. That is one of the most frequent waivers that we issue out of OMHSAS, allowing group size up to 12. So changing that regulatory standard will reduce administrative burden both for the OMHSAS staff who process those waivers, as well as providers who are needing to request those on an annual basis currently. The only other changes we're anticipating making in the 1223 package is removing language that has already been abrogated by statute and no longer in effect. And again, just like the 5100 regulations, that will make the reg a lot more easy to read and not need to cross-reference with other sources to understand what is currently in effect. The larger package that we are going to be starting work on is inpatient regulations. That will be inclusive of private psych hospitals, inpatient units in general hospitals, as well as extended acute care units that are co-located with either inpatient psych or private psych hospitals. This is really in the very early days. Our first step will be to send out a request for stakeholder input. I anticipate that will be going out on the OMHSAS listserv in the next week or so. There will be two versions of that. One will be targeted towards current licensed providers, and the second will be for any stakeholder who wants to weigh in and give us feedback on what should be included in our inpatient regulations. And then once we have that initial feedback gathered from stakeholders, we will be convening a work group later this year. We don't have an exact timeline for that yet or any details, but when we do have that, it will go out on the OMHSAS listserv. So if you're interested in participating, we would welcome you at that time to let us know. That is all of the updates that I have. I did see some questions coming in, so I'll look at what those are going to be. Let's see. So the first question I'm seeing here is about the four walls rule and what agencies need to be doing at this point. There is no change in the current guidance from DHS and OMHSAS. Folks can continue to operate as you have been operating. All of this work that we're doing behind the scenes will reduce the risk of operating that way, and we are looking forward to having that all be official and above board. But at the moment, no ask that you change anything with your current practices.
And then Jill, I think there's one more question in there from Diane Conway. She's asking, is there anything we can do to help with the General Assembly approving some of the changes that we were talking about?
Yeah, there's not a bill yet introduced that I can point you to a number, but we are working very actively with the House, in particular, the House Human Services Committee. So anyone who is vested and wants to see those abrogations go through, certainly encourage you to reach out to your legislators or to that committee. to express that support for that work.
Andrew Kunka is asking if we can repeat the different settings that the inpatient regs will apply to.
Sure. So right now we're looking at it being inclusive of private psych hospitals, as well as inpatient units, psych units in general hospitals, as well as any extended acute care units that are co-located in either of those locations, either co-located with a private psych hospital or co-located with an inpatient psychiatric unit in a general hospital.
Thanks, Jill. And I was waiting to answer questions about what you had presented to circle back. Mike Quinn had asked a little earlier in the meeting if we had any insight about 988 funding, either at the federal or the state level. So Jill, I'll start, and then if there's anything I miss or anything you want to add, feel free to do so. So I think, as some of you know, there were some proposed pieces of Governor Shapiro's budget that would help support the crisis system kind of more broadly. So some funding, $10 million to support our 988 call centers and or work related to what those call centers do, as well as $5 million to support emergency behavioral health walk-in centers. So there was some proposed funding at the state level. Now, a reminder about where we are in the state budget process. So the governor delivered his budget address, which is his proposals for funding, back in February. Then all of the state agencies participated in appropriations hearings with the House and Senate to answer questions about that proposed budget. And what's happening right now is members of the House and the Senate are working on developing their budget proposals, and they're conducting lots of conversations and negotiations about how they would like to spend the money, usually using the governor's proposal as a starting point. So the goal is to have a finalized budget, meaning approval from the House, the Senate, and the governor before July 1st. Historically in Pennsylvania, we do not always meet that deadline, so we'll see if that is the case this time around. But at this point, kind of those are the moving pieces around the governor's proposed budget for the 25-26 fiscal year. In addition to that, at the state level, I will say that we still need to have conversations about the sustainability of our 988 call centers. So many other states are struggling with a similar situation. To this point, we have relied on federal grant funding to sustain those call centers. So some states have moved to various models to support the sustaining of those call centers. Some use a fee or a tax imposed on individuals who use mobile cell services. Some have collected fees from hospitals or health systems and used that to support. Some are just funding it through state level dollars. So there's, a variety of different kind of models for sustainability. We haven't had a lot of traction here in Pennsylvania with those conversations. There was some legislation floating around. I don't remember if it was late 2023 or early 2024, where we were proposing adding a fee onto cell phone bills that would help support those operations. That never really got very far within the General Assembly. I don't believe there's a current bill floating around with that language in it right now. So, that's something that still remains to be a big question mark. And I know with so much happening at the federal level, there's a lot of concern. And so, maybe it doesn't feel like now's the right time. But, we're getting increasingly concerned that the federal government may not continue to fully support and sustain these services through grants. And Pennsylvania is in a risky position right now because we really do rely on those federal funds to support these activities. So, Jill, I don't know if you have anything else you wanted to add to that, but feel free.
No, I think that was pretty thorough, Jen. We did get a follow-up question about the 10 million and if that was, Diana, I think you got cut off, but I think you're asking if that was to sustain current projects.
Yeah, so and then she typed 911 system. So to be clear, the 10 million I'm talking about is for 988 specifically, not 911. And it would be potentially for a couple of different purposes. So if, for example, we don't receive sufficient federal funding to sustain the 988 operations, we would use that $10 million for the purpose. If federal funding continues to flow to support the 988 operations, we would use that 10 million to enhance the system through, various activities. So some examples of things we might use that $10 million to do would be improve the interoperability between 911 and 988. So really defining good policies and processes to ensure that behavioral health related calls are getting routed to the 988 system and that the 911 system is, available to use for the true, physical health related or police related emergencies that are not behavioral health. So that could be a piece of it. We've also got a real need to improve our response rate for the text and chat features that are available through the 988 Lifeline, and that would require some cost in terms of hiring additional staff and implementing new technology to support that. There's a specific technology platform that has to be used by the call centers who receive texts and chats. So we might use a portion of it to do that. And then there's an opportunity to just look at the 988 call centers as a whole and some of the workforce challenges that they have, significant turnover. One of them is operated almost solely by volunteers. And so, an ability to flood some additional dollars into that system to create some more sustainability for the workforce there. So it kind of depends what happens at the federal level, but the 10 million is a good cushion to make sure that we can sustain those operations or potentially enhance them if we continue to receive federal resources. Okay. I don't see. Am I missing any other questions?
I am not seeing any others, Jen.
Okay. Well, while I'm wrapping up here, I'll give folks an additional moment to think and type if you need to. So a reminder that our next stakeholder webinar is scheduled for July 17th at 3 p.m. If you have a topic that you'd really like to be able to discuss, or if you think of a question after the stakeholder webinar today that you forgot to pose real time, you can do that using the resource account that Josh is pointing to on the screen right now, ra-omsas correspond at pa.gov. And I don't see any additional questions that have come in that last minute or so. Oh, I see one. Beth Pickering. Can you repeat the activity surrounding inpatient psych units? I stepped away and missed the detail. One more time, Jill.
No problem. So we are doing early preliminary work on creating inpatient psychiatric regulations as an updated package that will be inclusive of inpatient psychiatric units in general hospitals, private psych hospitals, as well as any extended acute care facilities that are co-located with either of those settings. And we will be sending out an initial survey to gather information from both current licensed providers as well as broader stakeholders, hopefully in the next week or so, as our first step in that process.
Great. Thank you, Jill. All right. Well, thanks, everyone. I hope you have a wonderful week, and we'll see you again in July.